Okay, so we're going to talk a little bit about thrush. And I want to tell you that I was a little kid in the 60s, and thrush for us was we would watch a TV show of these cool secret agents, The Man from U.N.C.L.E. You remember that? These old people, we remember that. So the bad guys were called Thrush. And I forget why they were called that. Anyways, but you got Thrush, which is not The Man from U.N.C.L.E. or the bad guys. But what is thrush, and how do you get it, and why do you get it, and what to do about it, and what should you worry about it? Basically, as you lose weight, your body begins to metabolize fat. That's good. When it metabolizes fat, you may remember what it does. As it metabolizes fat, you may remember from your previous attempts at low-carb dieting that you want to become ketotic. Remember that? Where you maybe even get the little dipsticks and put them in the urine and see if you were becoming ketotic, because ketones are the smaller chemicals that get metabolized out of fat. So this is good that you get ketones, because that's fat being burned. The disadvantage is that ketones are a lot like another chemical that you're really familiar with, a harsh chemical called acetone. That's what they have in nail polish remover. Now, so your body then is releasing ketones or nail polish remover into your bloodstream. If it goes out into the mouth, you get this kind of awful taste. So anybody had the awful taste and you can't clear it out no matter how much you brush your teeth? That's that unpleasant taste. That's the release of the acetone or ketone, which is a lot like acetone. I think it's one carbon methane molecule on the side different. So that acetone, that ketone released into your mouth changes the environment in your mouth, and in some cases allows a bad bacteria, in fact it's not a bacteria, it's a yeast, called Candida. That's not Canada, it's Candida. And that yeast can overgrow, cause an infection, and it also happens in babies when they're born. So you may, if you're a mom, you may have seen baby have some thrush. Our big babies can get thrush, and they get that because of that change in the environment in your mouth. And the treatment is to take an antibiotic, an anti-yeast drug. One of the good questions we got this morning is, Dr. Rutledge, I see you're using nystatin as the drug to treat my thrush. I guess you haven't caught up with the 20th century yet, or the 21st century, because the best treatment is now a simple one-drug treatment with diflucan. Okay. How comes, Dr. Rutledge, you're giving us the cheap, older stuff, the nystatin, which is so icky and you have to swish and swallow it? And the answer is diflucan's a great drug, but it's somewhat damaging to the liver. And so like Tylenol and alcohol, we're not crazy about it. It's not the end of the world, and some doctors, local doctors, have put our patients on diflucan with no danger. But just like we want to avoid the alcohol, avoid the Tylenol, we want to avoid the diflucan because it's a hepato-damaging, a liver-damaging drug. And so you got stuck with it, you got thrush, and you just showed us your thrushy tongue, but it's getting better with the nystatin. How's that nystatin?
It tastes better than I thought it was going to. Like people are talking about it.
Good. Good. All right. Well, we apologize for that. Any other questions about thrush and nystatin and diflucan? Okay. Good. Oh, I'm sorry.
How long is it going to last?
You know, it varies. It depends on you and your fat and how much of the ketones are released, how much of a resistance your body has, and then how soon the good guys, the good bacteria, can grow back in there. So you can help shorten it by the nystatin, but you can also shorten it by taking some additional good bacteria, which you can get by eating yogurt. But it varies. In most people, it's a couple of days to a couple of weeks. Never had it longer than 2 weeks.
Dr. Rutledge, on Sue's bottle it says to swish and spit, but we are supposed to be swallowing it, correct?
That's a very good question. So what should you do with nystatin? Swish and swallow or swish and spit? It turns out that just like you can get a yeast infection in your mouth In more serious cases, the yeast infection can actually creep down into the esophagus. Now, that almost never happens except for immunosuppressed people, like somebody on cancer chemotherapy or AIDS patients. But it's not a terribly bad idea to swallow it. On the other hand, most of our patients are in such good health, they don't have to.
Okay.
So the answer is either one's okay.
Okay. Yeah.
Yeah. So you can swallow or you can spit.
Okay.
It's personal preference. Okay, so that's our nystatin talk for this morning.